would I also flex my knees? Now, think about, I want to make sure everybody's got the question before we answer.
Because the rectus...
No, don't answer it yet. It had nothing to do with the rectus. Okay, the concept is closed kinematic chain. And when a muscle contracts, what does it move? I.e., I don't like origin and insertion. I like proximal and distal attachment. So, what is hip flexion? When I'm standing and I flex my hip, do I not bring the pelvis forward? But I don't want my pelvis forward. So what else is hip flexion? It's not just movement of the pelvis anteriorly, it's also movement of the femur anteriorly. So if I bring my femur anteriorly, that results in knee flexion. Now if I want to keep my pelvis sort of upright, but it's pulling me forward, my other choice is to bring the femur anteriorly, which will keep my pelvis upright, but now it causes flexion of the knee because it's in a closed kinematic chain. Now, I'm also, when I got my pelvis forward, putting a lot of stress on compressing the vertebra posteriorly. So I'm going to tend to walk around like this. I'm going to have a little bit of increased lordosis. I'm going to be compressing back there, and I'm going to have abnormal forces through my knee joint. It's probably not going to hurt here because I'm getting rid of that hurt by causing hurt there and here. If you remember, when we say hip flexion, it could be flexion of the pelvis at the hip, or it could be flexion of the femur at the hip, or it could be flexion of both at the hip.
I'm going to have to digest that.
Don't digest it. Grab somebody and put them in that position. Put them in that position and watch what they want to do. Ask them. Everybody stand up for a minute. Just. Okay, I want you to flex your hips. Pelvis at the hips.
Do you want to keep the knees straight right now?
Right now.
Okay.
Flexion of the pelvis at the hips. Going to give you a what?
Anterior rotation.
Anterior pelvic tilt. What does it feel like you want to do?
I want to bring forward.
I want to straighten it back up.
But you can't do that.
But I want to.
I know you want to, so how can you get your pelvis upright? Huh? Yeah, don't you feel like you want to flex your knees a little bit if you're going to stay in that position? So you can get your pelvis back. Now, you may not feel like that, so you'll walk around with an increased lordosis. Other people will flex their knees because what are you doing? You're looking down, and your brain doesn't want to look down. Your brain wants to look, so look forward. Get your head up and look forward. Now, what does it feel like you want to do now?
I straighten up.
But don't. You can't.
I don't stop myself.
Well, we'll fix it for you. Go forward. Flex. You're not even flexing your hips. You're just you're doing it in your trunk. And your pelvic tilt.
My back in place is what I'm doing.
Well, no, let your pelvis go anterior. Anterior pelvic tilt. Well, you're going to have a hard time with that. Now, we got you. Now, come upright. Look forward. Don't you feel a little desire to flex your knees? No, you don't. So you're going to have increased lordosis. That's where you're going to hurt when that happens. Later on, I think you'll be in flexion. But you see the closed kinematic chain here? How it's working? What? Not if you use your quadriceps to hold you up.
So you end up with
What? She's still not clear.
No. I'm trying to see. Okay, so if I'm down here like this,
Okay.
Am I firing the hamstrings right now?
I hope not, because it'll make your butt go down.
That's why I'm asking you this, because I'm trying to see the process of the pain pattern.
Here, put your hand here. Do that now.
Do what?
Get into that.
Rotate?
Now come upright. Let your knees flex.
The quadriceps are tight.
The quadriceps are not tight, they're
They're
contracting.
contracting.
Yeah.
Eccentrically.
Huh?
Eccentrically?
Well, right now, isometrically. Because you're
But
not
well,
moving.
to get there, they gotta go eccentric, and
Yeah.
then they have to hold.
Yeah.
So that's why the quads are gonna get tight.
Yeah.
They're tired.
Yeah,
Feel like crap.
yeah. Okay, think about it. We'll come back to
Yeah,
that.
see, I'm gonna think.
Okay, I want you to grab a partner. Set somebody up on the table. One of you sit in a chair. And I want you to play with the knee. I want you to